coming up on Stephen and Chris. Get a taste of the paleo diet from a best-selling cookbook author. And learn about a machine that freezes away fat.
Women under the arm, men love handles, anyone abdomen, women bra roll are the four most common areas.
Love handles? Yes. Can you move over, sweetie? I'm going to get mine done.
Welcome back, everybody. Here to tell us about a new technology that helps you lose stubborn fat is plastic surgeon Dr. Zel Krajden.
Welcome to the show. It's great to see you. Thanks for being here. Well, you brought in a very cool machine, and that does something called CoolSculpting. What is that?
It's a great machine, great piece of technology. It's new in the past year. If you look at fat cells, they can respond to different types of energy. They can respond to heat, radio frequency. They can also respond to cool energy. The idea is when fat cells get to 5 degrees Celsius, they essentially explode. And as they explode, they're excreted in your liver, and you lose that area of fat. You can lose up to 1 inch of fat in that specific target zone.
Okay. Wow. So who's a likely candidate for this kind of thing?
You're looking at someone who's near their ideal body weight, within 10 pounds of their ideal weight. So not someone who's overweight and who has a realistic idea in their mind. They want to lose between 1 centimeter and 1 inch and contour, love handles, stomach, back rolls,
so is it almost like that stubborn fat that you know when you work out, and you just can't get that little bit left gone.
Most people, as they reach their 30s, 40s, 50s, even if they're a great weight and have a good shape, there's a few areas if you wear too tight underwear, skirt, clothes, it pops out. It really targets those zones really nicely.
You're really fine-tuning. Let's look at some photos here.
Some before and afters. Now, talk us through what's happening over here.
So here's a lady, you know, roughly 8 to 10 pounds overweight, few areas of lumpiness, cellulite, little extra fat. And more or less, you treat each area as a zone. Anterior abdomen is one zone, flanks are one zone, and they sit there, sucks the fat out, cools the area down to contour it. Here's another photo. Again, someone who's very slim, in tight clothing, looks like a slim individual. In a bikini, a little bit extra tissue above and below the belly button. You contour and really cool them right down.
This is different than liposuction?
It is different, and it's a non-surgical technique. No sedation, no anesthesia, no cuts.
Wow. Okay. And now this one here, so it is very different than liposuction.
Exactly. I mean, liposuction is your more surgical, slightly more invasive, 4 millimeter scars, usually very light twilight anesthesia, but you can reduce between 1 and 3 inches of fat. So for that little extra cost and recovery, you are getting a more pronounced result.
And how long do these sessions, how long do they take?
CoolSculpting generally is about an hour. So I have lots of patients who come in over lunch. The treatment itself takes between 45 and 50 minutes. By the time they get dressed and undressed, they're in and out in 1 hour.
And how about the pain level?
Pain level, the way I describe it, almost imagine someone sucking at your skin, a bit of a cool device, again, about 5 centimeters. Most people describe it like a cold pack that's been in your skin a few minutes too long.
Okay. Let's go over here.
We have a live demo of CoolSculpting. I think it's really cool.
We're going to do it here in the studio.
And this is Jennifer. How you doing, sweetheart?
Hi, sweetheart. How you doing? Thanks for coming to see us. Hi, darling. How are you? Good to see you. Okay.
So the great thing about this is, I mean, if you look at in the United States, you're looking at about 1 million liposuction procedures a year, surgical procedures. If that's your base population, about 50% of adults over the age of 25 have areas of fat that they don't like. Therefore, the target market for CoolSculpting is much higher than that 1 million. So it's someone who comes in on their day off, comes in during their lunch, once an hour, they're on their iPad, they're on their smartphone, and they sit there, have the treatment done, walk right out, no bruising, no pain. Some people will have numbness for about 1 to 2 weeks in the area, but it's really not painful.
And I want to talk about, so if we can even see it kind of happening and how to, so then where does the fat go?
Very good question. So everyone has a certain number of fat cells in their body, whether it's 10,000 or 1 million, depending on your body type and height. Once those fat cells are gone, you do not grow new ones. And if you stay the same weight, you're not going to gain weight in those areas. Those fat cells more or less explode. They undergo what's called apoptosis, or programmed cell death. And it's excreted in your liver like any byproduct.
Oh, wow.
So is this good for areas like, say, under the arm area for women?
Is an area, for sure. Women under the arm, men love handles, anyone abdomen, women bra roll are the 4 most common areas.
Love handles? Can you move over, sweetie? I'm going to get mine done. I'm getting up here.
So go ahead, please. Start.
Okay, show us what you're doing.
So the applicator goes on, has a bit of a cool gel, almost feels like having a washcloth on you. Sits onto the skin. This part takes usually between 1 and 2 minutes to get the area prepped, cleaned. The applicator that Claudia's gonna put on in a few minutes sits onto the skin, pulls it up almost in a slight vacuum with that cool temperature from each side to start to melt that fat away with that cool energy.
You're saying, but that's interesting because you're saying it's melting it, but it's using cool temperature.
Exactly, and the way I describe melting is, imagine a fatty cell at the end of a prime rib. It has a very viscous consistency to it.
Yes.
The cells explode, and more or less your body melts it away with a little oily texture. That's why I tell my patients for about a week or two after to gently massage the area to help break out any residual fat cells in the membranes.
And is it immediate? Like as soon as this is done, can you, or does it take a little while?
Anything, they feel a bit swollen for that first day or two.
Okay. Right.
A sensation, it looks swollen, but within 2 weeks you see 50% improvement.
Got it.
And 2 months for the 100%
So you don't do this if you got a party the next day and you just bought that really tight dress thinking that this is going to make you look excellent in it.
Exactly.
Right.
Have a healthy breakfast that day instead.
And then wait a couple of weeks for the fat cells start to move out.
Definitely.
I see. Okay. So let's get. What are we going to lay on it? Let's see this
working here.
That looks like a giant hairdryer.
Yeah, right.
It's wonderful. So you can sort of treat one zone at a time or multiple zones depending on if you're having one zone treated.
Let's talk about the zones and let's talk about cost while we talk about zones.
The cost looking at $750
for an area.
For an area.
What's an area?
One area would be abdomen. Both love handles would be in one other area.
I'm just adding that up in my brain because I'm going in next week.
Now, also, while we're doing this here, can we talk about the risk? Please go ahead with the treatment.
Go ahead.
Yes.
In terms of risks, number one is having realistic results. I tell patients, I'm a physician, my job is to make sure who's a candidate, who's not a candidate, and you have a realistic idea in your mind of the results you're gonna get. And the main issue is numbness afterwards. I tell patients they will have a pins and needles sensation for up to 2 weeks. I don't call it a complication, it's more a normal sequelae of the treatment.
Yeah.
Right.
And now, does this fat come back? Can it come back?
If you stay the same weight, it will not come back. If you start gaining weight, all bets are off.
All bets are off.
Yeah.
I was going to say, so it's not, you're not,
No.
this is not a diet plan.
No, this is not like diet, exercise, and all those normal, healthy things.
This really is fine-tuning the work that you've already done.
Exactly.
Okay.
So, Jennifer, what are you feeling right now, hon?
A little bit of suction and cool.
Suction and cooling, just like Dr. Krajden said. Okay.
So you literally could do you could get on your phone right now and you could talk to people and you wouldn't have any problem at all. Yeah.
Totally, very tolerable.
Could you have a little nap, like if you were having a little rest? Could you?
Yeah, it's very comfortable.
It's completely pain-free.
And this is for people, like, is this for everybody, or is it maybe people that shouldn't do it?
You're looking at people who are otherwise healthy, who have good skin tones, they don't have a lot of stretch marks, loose hanging skin, and again, someone who has a realistic result, they're in that 5 to 10 pound ideal range, and they just want to fine-tune that last few centimeters just to sort of suck them in.
So how long again does this take? Just exactly this? This is all that happens?
45 minutes.
45 minutes. Well, I'll tell you, I'm very thankful you're here to talk us through all of this.
Thank you
Very
so
exciting
much.
stuff.
Thanks,
all the new things that are on the market for you guys now, it's just incredible. It really is incredible. I think you're gorgeous, but you're obviously going to be even more gorgeous after. Thanks so much for coming in to see us. I bet you'll stay here for 45 minutes longer, but we're going to take a break, guys. We'll be right with you after the break, okay? We'll be right with you. We'll be right with you after the break. Are you ready to go? This is interesting. It doesn't hurt at all.
It really